There are multiple barriers for the care of women with bleeding disorders, especially those with von Willebrand disease. It's the most common bleeding disorder. The most glaring barrier is that the most common manifestation of excessive bleeding amongst women with inherited bleeding disorders is that of heavy vaginal bleeding, whether it be heavy menstrual bleeding, abnormal uterine bleeding, or postpartum hemorrhage. And unfortunately, societally and also medically, across the entire human race, no matter the culture, talking about vaginal bleeding is heavily stigmatized. And that is true even in an examination room with a medical health provider. So the biggest barrier is that there are many patients that we are not meeting because the initial conversation to discuss heavy vaginal bleeding is not being had. So it starts with empowering and enabling patients to encourage them to speak about their concerns surrounding heavy vaginal bleeding first. Secondly, to enable and empower physicians and other healthcare providers to assess for heavy vaginal bleeding in an appropriate way. And unfortunately, there's a lot of evidence to suggest that that's not often being done appropriately. And then third, to offer treatment. So we have to move away from normalizing, from stigmatizing, from silencing discussions surrounding heavy vaginal bleeding so that we have the opportunity to treat our patients. So that would be one of the first things that I would suggest. So how would I imagine that the results of such studies and trials will influence care of heavy vaginal bleeding in women with VWD? My hypothesis, of course, with the Empower trial is that it will be very effective because that's been my clinical experience with these patients, and I know the experience of other physicians who manage patients with bleeding disorders. And so the expectation is that this will provide us with high quality evidence that will help us change guidelines and allow for proper care of women with heavy menstrual bleeding who have VWD. So that important step in generating the evidence and then translating that knowledge in the form of guidelines and other targeted knowledge translation interventions and implementation strategies is really important because normalization of heavy vaginal bleeding from the patient's perspective, but also from the healthcare provider perspective, is so deeply entrenched that knowledge translation piece is so critical to allow everybody to really take the next step and apply the evidence in the future. So I expect a change in standard of care. That's what I expect. That's what I hope for. My message for young women with heavy menstrual bleeding today is that heavy menstrual bleeding is not normal. Having to change a pad more than every 2 hours, saturating a pad, passing clots, staying home from school and work because your period is heavy, having to get up in the middle of the night to change a pad or tampon because you're soaking through, having to double up with a pad or tampon, that none of that is normal, even if your mother and your sister and your aunt and your grandmother have experienced the same. So it starts with stopping the normalization of heavy menstrual bleeding. Number 2, having iron deficiency is not normal as a woman. Number 3, having iron deficiency anemia as a woman is not normal. Having mommy brain is not normal. Craving ice is not normal. Being incredibly fatigued, decreased exercise tolerance, feeling like your memory, attention, and speed is negatively affected by your health condition is not normal. So it's time for treatment. It's time for treatment, and it's time to change the conversation. But it starts with emphasizing what's truly normal and what's not normal. And it's really hard to define what's normal or abnormal in patients with von Willebrand disease or any other bleeding disorder that affects women because women are not naturally bleed free. Over the course of our reproductive years, we bleed regularly with menstruation, after childbirth, etc. And so that's why defining what's abnormal versus normal is so much more challenging than, for example, in men and boys affected with hemophilia, because boys and men who are not affected by hemophilia don't bleed into their joints and muscles. So it's very clear the line between what's normal versus abnormal. And so we need to be very, very diligent with girls and women in clearly defining what's normal versus abnormal. And that's where the work needs to be done.